Hi there, Dr. Hizon here to talk about the Pediatric Well Visit documentation. As a general disclaimer, please refer to your particular doctor, as this is a general course not intended to be a medical treatment, and your particular situation may vary. So on the pediatric evaluation and visit, it's a chance to focus on overall health and wellness. We look at prevention, especially on immunizations, tracking the growth and development, and this is when they may use a growth chart, raising concerns that the parents and guardians might have, and using a team approach to create relationships and determine the needs of the child. So on the physical exam, it's prenatal and birth history, developmental history, social history, environmental risk, immunization history. We'll look at their height, weight, and body mass index, make sure their blood pressure is okay for age, as well as how their overall exercise and nutrition approach is going. There usually is physical exams, and the screenings differ by age, labs, as well as referral for testing. And the exam is based on the age and risk factors, and you can check with the Pediatric Academy for the latest recommendations. Usually there's counseling, medications, and referrals that are recommended. And in lifestyle, we're going to encourage them to use car seats, seat belts, and helmets to get normal exercise, healthy diet, as well as the proper immunizations. And if the medications, they need to be taken as prescribed and followed with their primary care medical provider. So in documenting for the patient on the pediatric visit, say a 5-year-old female presents today for annual well visit exam for a child. And this is the typical type of template we might use. So Sarah is a 4-year-old female, presents for annual pediatric exam, and you go through the different screening, health status, developmental status, use of complementary or alternative medicines if they use that. Obviously, we're hoping that they don't use any tobacco, alcohol, or drug use, but you need to look at that. Is there any signs of abuse or neglect? And are they having any sexual activity? Obviously, that's inappropriate in the younger children. How is their psychosocial evaluation, developmental risk, immunizations, and their health risk behaviors? And then we'll do the general review of systems. Obviously, we do ask, especially in the teenage population, about tobacco, about how's their exercise, nutrition, sleep, have they gained or lost any weight, and then step through all of the review of systems. This is not an unusual template for the pediatric exams, and you can step through all of these in terms of the eyes, ears, nose, and throat, cardiovascular, abdomen, back and throat, genitalia. Again, this would be done if appropriate, extremities, skin, and neurologic, especially for age. So in the assessment and plan, understand that this is the chance that you can say if this is a simple or complicated case that requires straightforward or complex decision making, and this is a chance for the provider to discuss their reasons and rationale for why they are diagnosing and treating the patient. These are your typical codes that might be used in a well child exam. Z00.12 is a screening encounter for routine health exams, and then there's several other ones that can be used. So in the plan and treatment, patient education, medications if needed, and follow up with the primary care medical provider if indicated at a certain amount of time, and also if they need specialty consultation. So pearls and pitfalls for documenting for the patient with a pediatric visit. Be sure to document growth spurts and milestones. Compare the extremities. Always compare laterality in terms of left versus right. Be sure to document all treatments and illnesses in the past. Learn the various questions, and please ask your doctor if you have questions about the pediatric wellness exam. And in primary care, be sure to document about the quality measures. So thank you very much, because while doctors save lives, medical informatics specialists save patients. And this is the kind of thing that we want to do to keep providing good care to our children.